You want a film of this povidone iodine to be there and take care of the lid margin. That is important. Where you have the discharges or the opening of the meibomian glands which are there, those have to be taken care of. So you paint the lid margins also and isolate this well with the adhesive drapes when we are using them. So see that once you do that, you have to be careful so that you keep away the lashes. The problem is the bacteria are not at the tip of the lashes but at the base of the lashes. It is where they are there. So even though the tips are going to be in your operative field, it's more of a nuisance. For that sake, also you have to see that they are away from your surgical field. Here you see the drape being cut, and once it is done, go ahead and use the speculum, separating the lids as well as keeping away the lashes. And maybe you can give some relaxing cuts for the drape, so you have good adequate exposure all along. So you can see that the lashes are now away completely from the operating field. It is clear now. Coming to the next is having a clear corneal incision or a clear corneal. If you have a clear corneal, best with good integrity would be a square clear corneal incision, which is more stable compared to the others. So see that whatever your length of the tunnel matches with the length of the incision which you are going to use, and reduce the number of times you enter with your instruments into the anterior chamber, so that chance of contamination is also reduced. And practice so that we reduce the complications. One, we do have a complication, we must be in a position to handle those complications also well. The other thing which has certainly brought down the infection rate with all these methods or the procedures, as I had told you earlier, with this the infection rates are further decreased is the use of intracameral antibiotics. The common ones use the moxifloxacin. You could use it directly. Use about 0.1 ml, which will be delivering about 0.5. Many people go ahead and use vancomycin and cefuroximine also. The only reason these drugs are preferred is most of the organisms that are causing the infection happens to be gram positive, or coagulase positive, or negative. So these drugs are quite effective against these bacteria. So certainly please go ahead and make use of it. And depending upon any further need or any risk which you see, you could again